When I start a shift, I take the ferry from Kirkwall out to Westbury, and that's an hour and 20 minutes on the ferry to get out there. So when I'm in Westbury, though, my commute is fairly short. It's to walk out the flat, down the stairs, and in through the back door into the surgery, because I live above the surgery. So there's rarely am I caught up in traffic on the way to work or on the way back from work. So just to give you some idea around the impact for patients, if a patient needs to be seen in Aberdeen, for example, so a patient in Westbury, if they're needing to be seen in the Balfour in Kirkwall, they would go in on the morning ferry at 9 o'clock, and they'd come home on the evening ferry at 6 o'clock. So that's how long a patient, a visit to hospital takes for a patient to Balfour. If it's to go to Aberdeen, which is our tertiary referral centre, it's 3 days, and that's because of the way in which the ferries and the flights to Aberdeen work. So for a patient to see a consultant in Aberdeen is 3 days. And you can imagine if they go down there and it's for a 10-minute consult to have their hands patted and to say, thank you very much, off you go, that's pretty galling. So again, one of the silver linings of this black cloud of COVID is that Teams and near-me consultations are something we've been working and shouting for at least 6-7 years, are now really become part of routine work. So that's been a real benefit. Ferries will get cancelled. You'll have ferries cancelled maybe for a 24, 36-hour period if you've got a big storm coming through. The planes, we've got small Islander aircraft, the 8-seater aircraft that go between Kirkwall and the islands, and they actually can often fly in weather that the ferries will be cancelled in. It will just depend on the wind direction. In terms of emergency medical evacuation, then the Scottish Ambulance Service helicopter will not infrequently be unable to fly because of the weather. And if that's the case, depending on what the situation is, then we may call in the Coast Guard helicopter to take patients out. But the rule of thumb there is that we'd use the Coast Guard helicopter if it's life or limb threatening.